problems that we see. It is also affected in a lot of kids with dyslexia and that combination. They have trouble holding information in mind, and it's subtle, so you don't see them squirming necessarily. They might be squirming if they can't focus, but you don't see them squirming quite the way that you see the hyperactive kids squirming. It takes a lot longer in some cases to pick up on this in kids that get diagnosed later when they have the predominantly inattentive type of ADHD. But working memory problems occur in other disorders as well, so it's not specific to ADHD. We see working memory problems in anxiety, OCD, brain injury, schizophrenia. In ADHD, I like to tell parents that it's as if that instead of a blackboard where you write something on the blackboard and it stays there until you actively reach up and erase it, working memory is a little bit more like an Etch-a-Sketch, where you write something there and if you move, it's gone, it's just erased. So that mental sketch pad in ADHD is a little bit more tenuous than it is for other kids who don't have a challenge with working memory. These are the criteria to diagnose this predominantly inattentive subtype of ADHD, and I'm not going to go through all of them. This is just by way of saying, for anyone who is not aware that there's more than one subtype of ADHD, and there is one subtype that's subtle and takes a lot longer to hone in on, this is that subtype, the predominantly inattentive subtype. It does not involve the hyperactive impulsive parts. So building up from inhibition and working memory, we've got more complex executive functions that are the kind of things that get worked on directly with folks like executive function coaches. So getting started on effortful tasks, getting down to business, buckling down, as one of my high school age clients used to say. It's hard to buckle down. Metacognition, which is just saying, a way of saying thinking about thinking. So self-awareness, knowing that you need to buckle down, knowing that you need to stay with your homework, self-monitoring, staying with it. And then regulating attention fluidly, so being able to stop something, even though it's fun, and shift gears to re-engage in something that's not so fun, but really needs to be done now. Dividing attention, like I'm doing right now, looking at the time, realizing I need to keep moving for Dr. Aloya. Organizing, planning, prioritizing. All these things require that a student be able to inhibit impulses to go do something more fun, and that they be able to hold their goal or their task in mind, in their working memory, long enough to finish whatever it is they're supposed to be working on. So those basic core executive functions are really the important underpinnings of the more complex executive functions as we go along. Now, everyone in this room knows that we can all have executive function failure at some point in time. I could probably come up with a couple of moments in the last week where my executive functions were not my friends. They were not helping me out. Fatigue, stress, multitasking, too many balls in the air, as the picture illustrates. We tax our executive functions. We have capacity limits. We can't remember everything all the time, organize everything all the time. That's not a disorder. That's the limits of our human brains. So it's not the presence of occasional problems with executive functions that indicates a diagnosis. It's the pattern of strengths and weaknesses that you see across a number of different kinds of tests. It's not just the weaknesses, it's the comparison between those weaknesses and an individual's strengths that tells us that they are struggling when they shouldn't necessarily be struggling. So that brings me to, well, how do we find out about an individual's strengths and weaknesses? And that is the job, one of the jobs of folks who practice developmental neuropsychology. And a neuropsychologist is essentially a clinical psychologist that has gone on to get more specialized training in the study of brain behavior relationships. So Dr. Aloya and I both have basic degrees in clinical psychology, and then we went on and kept learning. We got training as neuropsychologists a little bit in graduate school, but we had to keep going to get additional learning about how to assess these things at a deeper level. So when we do an evaluation of a child's executive functions, we don't just give them a couple tests of executive functions. We want to know, we want a physical for their brain. We want to know what their strengths are, what their verbal reasoning abilities are, what their motor skills are like, what their learning and memory looks like, to make sure that we're not just focusing on a diagnosis, but that we're putting together a picture of this child's overall cognitive development. So having a comprehensive assessment, not just a few tests, allows us to get very specific in treatment planning to guide interventions that are going to go right to the heart of the matter. Not just maybe teach a child to be better at managing time or planning, but to help them understand that working memory is problematic for them. How do you compensate for a working memory problem? Or how do you compensate for a problem with sitting still? What do you do if you're impulsive or squirmy or can't get started on things? So the testing allows us, or the assessment allows us, to get very specific about treatment planning and to create a roadmap for future education. So to help parents pick schools, tutors, resources, providers that are going to get their child the best out of the overall opportunities that they're going to be able to take on. So what does a neuropsych evaluation entail? I'm going to go through this pretty quickly. This is just a way of saying, again, we get a lot of calls saying, could we come in for an ADHD eval, and will that take more than an hour or two? And our response is, well, 18, give or take a few, but this is why we say 18, give or take a few. So a thorough history of that child's development and family, genetics, all those things, family history, traumas, anything that child has been through we need to know about. Interviewing with parents and children, consulting with referral sources, therapists, teachers, everybody out there that works with that child has information that might be relevant. Rating scales that get filled out by teachers and parents. One-to-one testing with a child ranging from an hour to 8 hours of time, scoring, interpreting all that information, integrating it, and then sitting down with the family to explain it is probably the most important part, so that you understand as you walk away, what am I supposed to do with all this information? And then providing that written report for documentation down the road, and it's for other providers as well. So testing covers the following areas in general: intellectual functioning, achievement testing, learning and memory, attention and concentration, language skills, nonverbal skills, motor skills, executive function, multiple aspects of executive function, social, emotional, and adaptive functioning, which is why the 18 hours builds up quickly. So I'm getting ready here to turn things over to Dr. Aloya, and I just want to say that this is not all about ADHD, but again, ADHD is our kind of prototypical executive function disorder. So anybody can recognize problems with attention, but the question is, what's causing those problems? What are the underlying strengths and weaknesses? We are sometimes surprised when we get a child in the office to find that they have a very specific kind of problem that nobody had noticed before, only when we sit down and do these tests with them one-on-one. So the other important part of doing these comprehensive evals is ruling out things that might be a problem if we didn't look under the hood to find those issues. Because with conditions that involve executive functions, odds are there's going to be more than one thing that's challenging for a particular child. And with that, I am going to hand the clicker to Dr. Aloya.
All right, so the piece that I'm going to focus on to start with is the overlap between executive dysfunction and a variety of disorders. The reason for that, as Dr. Powell already spoke about, is that the brain is interconnected. So you look at this picture here on the left, you see that there are all these pathways that connect the front of the brain to all different areas. It's a really small subset of the connections. In fact, we love this picture. This is actually over 1 million fibers in the brain, all connected different areas. So what does that result in? Well, there's a link between executive function and fine motor skills, reading and writing, mathematics, expressive and receptive language, social and behavioral impairment, as well as mood disorders, anxiety and depression. You see a big overlap in all of these areas. Just because of time, I'm going to focus in on 3. So the first that I'm going to focus on are reading difficulties and the overlap with executive dysfunction. There's actually about 40% overlap between children who have ADHD or executive dysfunction and a reading disorder. It's a really large overlap when you think about the fact that in the general population of children, only about 10% of children have reading disorders. So this is one of the reasons that we recommend having a more extensive evaluation, because there's a pretty large chance that there might be something else going on. There are 2 different reasons why we see these overlap. One, as we've already spoken about, are the neurological causes. The pathways from the front of the brain through different areas, particularly the language area of the brain, is the same in executive dysfunction as it is in language disorders or reading disorders, and I'll talk about language in a minute. There are also shared impairments across the disorders. So in both disorders, you see processing speed deficits, you see difficulties with working memory, so it's not surprising that you might see deficits in reading or executive dysfunction at the same time. But that being said, there are also difficulties that come into play when you have executive dysfunction or you have inattention and you have to do a difficult task, like reading. So when you have to read, especially for the younger kids who are just learning to read, or the older kids who are reading complex material, you have to initiate, you have to sustain attention to this difficult task, you have to monitor yourself for accuracy when you're reading, and you also have to divide attention. So you have to pay attention to both what you're reading and what it means, accuracy and comprehension. We see something very similar when we talk about language disorders. Actually, research suggests that about 50% of children who show executive dysfunction also show some sort of language disorder. Again, typically only about 10% of kids in the general population show language disorders. Same thing here, neurological causes, this connection between the auditory or language areas of the brain and the frontal lobes. But there's also big behavioral impact. And actually, I just want to pause for a second, because one of the things that we often hear from parents is, absolutely not, my child talks fine, they don't have a language disorder. And I'm not really talking about basic language. Most of our kids have basic language. They can put together simple sentences, they can understand most of what we're saying. What we're talking about often that's impaired are some of the higher order language skills. And what that means is more complex language. Do they understand things like inferencing? You give them just a little bit of information. Can they pull together all of the other information? Or you talk about what we refer to as figurative language. It's raining cats and dogs. Be surprised how many kids actually think you're referring to the fact that cats and dogs are coming down from the sky. So it's this more complex language that I'm talking about. Two that I focus here on the screen, saliency can often affect receptive language. So saliency is something we talk about a lot in executive disorders because it's that difficulty knowing what to pay attention to. Many parents will say, well, my child can pay attention to a video screen for a long period of time, but if I'm trying to talk to them about their math homework, they have a much more difficult time. What's salient to them, what's important to them, might not be what's important to you. And saliency is something that's very difficult to regulate for kids who have executive dysfunction. So if you think about understanding the receptive aspect of language, what they pay attention to might not be what we want them to pay attention to in language, so they misunderstand part of what's being said. On the other side, we have expressive language. Again, what Dr. Powell was talking about in terms of that top-down processing, all the things that you need to think about when you're putting language together. So, for example, if you're trying to summarize something, who's my audience? What do I need to think about saying? For me, this talk would be different if I'm giving it to mostly parents versus professionals who have a lot of background. I have to stop and think, what do I need to talk about? I need to think about the details that I give, how many details I'm going to give, what order I give them in. Those are all executive functions. So even without a severe language disorder, if you have executive dysfunction, it's going to impact your language and make it that much more difficult. So the third area that I'm going to focus on are social and emotional difficulties, and that's because, again, there's a really large overlap here. When we think about, Dr. Powell already mentioned some of this with that emotional regulation, or social difficulties. We're talking about regulating our emotional reactivity, anticipating consequences of our behavior, inhibiting inappropriate responses, and holding different viewpoints in mind. So what you'll see that I did with highlighting the words in yellow, these are all things that we expect kids to do with their social skills, but each of those highlighted words are actually executive skills. So if you're struggling with your executive skills, there's an increased chance that you're going to have some social difficulties, and these are just a few of the reasons why. There's also a large overlap between executive dysfunction and emotional dysregulation, mood difficulties, particularly anxiety. Again, this in part has to do with the areas of the brain that are involved. But one of the things that we know in particular about kids who have ADHD or executive dysfunction is that you can almost describe it as if the world is coming at them rather than they are effectively moving through the world. So if you don't know what to pay attention to, what is salient, if you have trouble figuring out how to inhibit yourself, you're much less organized in the way that you move through the world, and that can make the world feel much more anxious. So what we often find is actually if you have effective treatment for attention and executive dysfunctions, you can significantly drop anxiety. That being said, hard to always figure out which one is the most important to treat. This is where a good evaluation can be really helpful. And sometimes we do think about just treating which is most impactful for the child. Okay, so we have all of these disorders of executive functioning, all the comorbid disorders, the other things that they're related to. So what do we do about it? It's a great question. I'm going to talk about one topic first. It's a little bit of the elephant in the room. I know a lot of parents don't like to talk about this topic, but it is important, and so we'll talk about medication briefly. One of the ways that we really like to think about ADHD, and if you're considering medication for your child, is making an analogy with diabetes. With diabetes, a child needs medicine. They don't produce enough insulin. They need insulin to help them, but you're also going to change their environment. You can't just rely on the insulin. You have to change what food is available to them. You have to educate them about what they should or shouldn't be eating and when. This is very similar in ADHD. We do know, and there's a tremendous amount of research, that kids with ADHD or executive dysfunction don't have as much dopamine in their brain. The way that their brain produces dopamine is a little bit different. So the medication can be helpful, but it's not everything. So a couple of points about that. What we know is that medication is most helpful for attention, not so much for executive functions. So then you might ask, well, if my child is struggling with all of these executive functions, why would I bother giving them medication? So I'd like to explain it this way. If you think about most of us who have decent, I feel like I have pretty good attention and executive functions, I would say I'm at that green line, maybe 75% or so. So what that means is that if I'm in a lecture like this, it's a fairly familiar topic to me, I only need about 75% of my attention to understand everything that's being presented. I can look down at my phone for a minute, I can take some notes about something that I want to do later in the day, and I'm still going to get most of the information. But if you put me in a difficult setting, perhaps I'm at a lecture, for me, it might be a neurological lecture, or if it's in a different language that I sort of know, Spanish, but I don't know very well, suddenly the attention that I need goes up. So that's it, that blue line, over 80% attention. So what happens if you have attention difficulties or executive dysfunction, and your level of attention is at that red line? It's down low, just this sense, I'm going to talk loud for 1 minute just to make this point. What if your attention is down here, but what you need is up here? Suddenly you have this huge deficit. And that's what we think about in terms of the benefit of medication. It sort of raises that floor for your child to be able to pay attention to the executive functions that they're going to be learning. And one of the things that we've learned, to go back to that point, one of the things that we've learned over time from research now is that if children do get medication and then have time to work on these executive skills, you actually see significant changes in their brains over time so that their brains look much more like a neurotypical child. It's not that the medication is changing their brain, it's that the medication is allowing them the opportunity to work on these executive functions, build the skills, essentially strengthen that muscle, which is the brain, and then it becomes easier over time, and that's what Dr. Powell was referring to. One last point, which I think can be really helpful to make, is that the use of prescribed medications are actually quite different from medications or from drugs, which work on the same areas of the brain. In fact, what we know is that, again, a ton of research to support this idea that when children who have executive dysfunction, disinhibition, impulsivity, if they're much more likely to end up using drugs, actually prescribing them medication greatly reduces that chance over time. So no number of parents come in with that concern, if we give them drugs, won't that make them more likely to use drugs, kind of using those terms interchangeably, and in fact the opposite is true. Okay, so having that sort of medication talk aside, what do we do as parents when we have children who struggle with executive functions? Well, Dr. Powell and I sat and talked about how can we combine everything that we've read, and there's a pile of books over here that are some of our favorite, I'm going to talk about them in a minute, all the lectures that we've been to, all the articles that we've read, into 20 minutes on what parents can do to support their kids with executive functions. Not an easy task. So we actually came up with this acronym called Easy Does It because of many of the key points that we wanted to talk about. So what does Easy Does It stand for? These are going to be some key points that we're hoping you can walk away with. The first is education. I'm going to talk about each of these more specifically. The second being assessment. The third, structure and scaffolding. The fourth is yes, it was actually very difficult to think of a word that began with Y. And so you'll see that yes is going to refer to saying yes to both your child's emotions and giving them limits. There's a balance in there. And then I'll talk about diet, optimism, exercise, and sleep. And then finally, making this both individualized but focused on a team. So this is what I'm hoping you're going to walk away with. And actually, what you can see that I'm doing in the talk is a little bit of what I'm suggesting that parents do with their children. Right? I'm simplifying it. I'm adding structure to it, and you'll see I'm going to go back and repeat and bring up these concepts over and over again. Why? Because this is a complex topic. It's new for many people, and how do you build skill? By making it structured, clear, simple, some of the things that we're talking about. So this first set is what I want you to think of as your foundation. As a parent or grandparent, other caregiver, what is it that you're going to be focusing on? The first, education. So don't think of this as easy. It's not. We've been studying this for years and years and years, and it's still a complicated topic. What do? You educate yourself, and everyone has already taken that first step, if not 10th step here by coming to a talk. There are lots of books. We have sort of what I would say maybe our 10 favorite in a pile over here. I couldn't fit 10 on the screen with you able to see them. I'm going to point out a couple of things that are important to consider. The first book, the reason I put it up there, it's a nice comprehensive book. Gives an idea of what ADHD and executive functions are, and really talking about it the way we've been talking about it in terms of regulation. Right? This is a concept that's not just attention, it's not just hyperactivity, it's regulating behavior overall, as Dr. Powell earlier spoke to. The next couple of books by Dawson and Ware give some really specific recommendations on things to do at home or in the classroom. Actually, The Late, Lost, and Unprepared is a similar book along those lines. That last book there, also very helpful for parents, is written by Cindy Goldrich, who's actually here in our audience, if you want to raise your hand. Cindy is an executive coach who was in New York, who recently moved here and does programming for parents specifically. We have other groups who are here in the audience, like Access to Achieve. Brandon Slade was mentioned earlier. There are some great resources in our community to help parents, more than just a 20-minute talk, because it's pretty fast to understand this and implement it that quickly. I put this one web page up there There are so many websites out there. I have not read everything that is on this website. Some of it is just blogging from parents, some of it is blogging from professionals, but what I have found is that most of what I have seen is consistent with what the literature suggests. So sometimes you can get on blogs and it seems like, yes, that makes sense, but actually it's a little bit counter to what we would really recommend. So being careful about what you find online is important. All right, so that was your E for education. Next we have assessment. You don't want to guess about your child's needs. I'm not going to talk about this one too much because Dr. Powell already talked about it, but you do want to try to have your child evaluated. As I already spoke about, there's a huge overlap, and this overlap goes in both directions. About 30 to 50% of kids with ADHD or executive dysfunction have learning disabilities, and the reverse is also true. If kids have learning disabilities, about 30 to 50% have attention or executive difficulties. So looking further is really important. It's just key to distinguish between each of these different disorders in terms of coming up with both the right diagnosis and even more than that, optimal treatment. So there's your A. So now we're going to move on to what I like to talk about as structure and scaffolding. What you don't want to do when you have a child who struggles in this area is expect that they're going to learn from repeated failure. It doesn't happen. What tends to happen actually is just that their self-esteem goes down instead. What you do want to do is try and provide as much structure and support as you can in a scaffolded way. So what do I mean by that? This is something that we talk about all the time with parents. Really getting this image in your head about a scaffold. A scaffold is put on solid ground. It has a very clear outline of where you're headed, and it has steps to get you there. You can't get to the top of the scaffold if you don't have the steps on level 1 or 2. So that's what you want to do as a parent when you're working with your child, is you really want to think about what are your expectations for a situation, and key is often defining those in advance. You know, if you want your child to sit at the table for 20 minutes during Thanksgiving dinner, the first time they hear that should not be at Thanksgiving dinner when they already have in their head that they want to go play a video game. Because now their emotions are running high, and when emotions run high, executive functions go down. So you want to do this at a time where you're maximizing their executive functions. Really picking 1 or 2 goals to work on at a time. So as I was thinking about putting together this talk, I was thinking about having moved here to Colorado and learning to snowboard. This becomes very obvious when we think about it this way. You get on the mountain, you're snowboarding, they had me do a heel edge over and over and over and over again. They never expected that I linked my turns, and in fact, they praised me every time I did a good heel edge. And then eventually I'd flip over on my stomach and I was going down the mountain on my toe edge. And over time, eventually, I was linking those turns. So it's no different with executive functions. With kids, you really want to break apart every task as simply as you need to, praise them for the part that they're doing well before you move on to that next level. And what we often find, just like I found with snowboarding, you might have to go backwards sometimes. You realize, oh, I didn't actually have that skill put together very well. So let me give you an example of that with children, and something that they're typically working on and parents are often fighting with them about is homework. So I might have a parent come in who says, my child just doesn't do his homework. I can't get him to do his homework. And I might ask a question like, well, where in the system is it falling apart? Because the way that I'm going to think about executive functions and homework is he paying attention in class when the teacher talked about homework? Did she write the homework down in his plan or in her planner? Did she bring the planner home? Did she bring the homework home, if that's a textbook or a worksheet? When she got home, did she remember to take the planner out to check to see if there is homework? Does she have a sense of time? Many kids with executive functions really struggle with time management. not even going to get into that now. In fact, there's a talk coming up in a few weeks if anyone's interested. It's at Summit Middle School, specifically on time management, because kids with executive functions really struggle to figure out how long things take.